It is time for our weekly Health Watch report with Dr. Syed Hussain from Trinity Health of New England. Fist bump for hygiene purposes. We're going to start today with an interesting report from the American Cancer Society that found that cancer rates amongst women under the age of 50 are now 82% higher than they are in men, whereas 3 years ago it was 51% higher. First of all, I'm surprised it's that much higher to begin with, but my first question is, are women in that age group under 50 developing cancer more, or are we just better at detecting it?
So great question. I was going to come to that, Tim.
Okay.
So yes, there has been an increase.
Okay.
Mostly in women under the age of 50, like you said, but generally under the age of 65 compared to men. There is some good news that I'll share with viewers later too, that survival rates have increased over the last few decades as more treatments have become available and advanced screening techniques. But going back to women though, so it can be a combination of both. It's likely multifactorial. What we're seeing is an increase in breast cancer, but also thyroid cancer in younger women. By multifactorial, I mean it could be because of early detection, but also because of lifestyle changes and things that we do every day that have a more longer-term impact.
Yeah.
Obesity, alcohol consumption. There's been a lot of discussion about ultra-processed foods, for instance.
Right.
So all of those may have a role to play, but we also know, as we see fertility trends changing, patterns changing over the last few decades, Tim, we know pregnancy and breastfeeding, for instance, confer advantages in terms of preventing cancer.
Oh, okay.
So all of those taken together, more research needs to be done in this arena, but suffice to say that all of those together, we're seeing an uptick in younger women. So what I take-home message here is, be your own advocate. If you see something wrong or if you feel something's wrong, raise your hand, see a doctor, make an appointment, go for that annual wellness visit, get that age-appropriate cancer screening done, breast cancer, cervical cancer.
Absolutely, and like you said, survival rates looking pretty good, so that would augur well. Moving on to bird flu concerns. They're back in the forefront after federal officials linked the spread of the virus in pets to them eating raw food. So what's going on there, and what can we do to protect them?
You have to be a little bit cautious. What's happening here is we're talking about raw milk products or raw food, especially raw meat or raw poultry. Usually this is what canned foods for pets, for dogs, cats, for instance, are made of. They're frozen little pellets.
Yeah.
You put them out, they get defrosted, and then your pet would eat it. But it's usually raw meat. Okay. So it's important that you trace where it's coming from. Are there other alternatives that are safer? Is there an FDA alert related to, or a state alert related to a particular product that you're using? Just need to be a little bit more careful, because we are seeing cats and dogs come down, especially cats, who can have a more dangerous outcome, including death, when they get H5N1, which is bird flu.
Okay, keep that in mind. Lastly, a new study found that weight loss drugs, we're talking about Wegovy, Ozempic, not only helping people to lose weight, but it's also improving their health overall, which is good news. How much of that is tied back just to the weight loss itself?
Great point. Most likely it is, along with some other factors that have yet to be studied thoroughly. So I would say just take this, it's interesting data and needs to be interpreted carefully. Because remember, when Wegovy and Ozempic, which are now blockbuster obesity-fighting drugs, were first launched, they were mostly for diabetes. Then we saw, hey, there's going to be a decrease. There's some weight loss that we're seeing as a side effect. But then that translated into, okay, these can fight obesity. Wow. But now we're seeing multi-organ benefit potentially, but more study, more research needs to be done to understand what's happening here and what are the other indications for these drugs besides the ones that I just mentioned.
Right. Always more studies need to be done. This is an ongoing process to learn more about just to build on top of what we already know about it. But of course, it certainly looks like the news is good this early.
It is, absolutely.
All right. Well, thank you so much, Dr. Syed
Thanks for having me.
from Trinity Health of New England. He's here with us every week.